Hello and welcome to the final show of this season. This season has been dedicated to you, our cherished viewers, who have been following this show for the past 10 years. And don't worry, if you are less than 10 years old, you are equally cherished. Indeed, we hope you continue to follow this show and prioritize your health above all else. I have a surprise for you this episode. One of our very own is going to be grilled in the hot seat with me. Yes, you do not want to miss this. Dr. KK has an interesting story to tell us in This Week in Medicine about the very first group of Ghanaian doctors that performed brain surgery without opening the skull. This show is brought to you by Vodafone. Further together.
Now you can be part of the extraordinary world of endless possibilities on Vodafone. With the best value and amazing data offers and services available in Ghana, your dreams are achievable. Get more for less with Vodafone data. Vodafone, further together.
Well, it's lovely to see you. Final episode for this season. Are you ready to bust the last myth?
Absolutely, bring it on.
I have a funny feeling you and I are going to have a as usual.
Oh,
Not going to agree.
I mean, so as we're leaving, I want everyone to see me as a very understanding person. So anything you say today, I'll let it slide.
And I mean, I know. Let's go see what myth you have today.
Okay, Mugiyaru.
Icicle seats, hey, the water is so hot. The woman can hardly squeeze the thing.
So some sentiment.
Oh, please.
Yeah. Something there.
Oh, my lovely Dr.
No, it's okay. I won't talk.
Oh, Dr. Kekin.
Everything you say is right. Everything is possible.
No, but seriously, do you think it happens?
Let's Fema answer first.
Let me set the premise.
Because I agree with Fema.
Let me set the premise.
Yeah.
You know that the Ashanti tribe does this a lot.
I am Ashanti, by the way.
They do that. And you know the Ashantis
My head was molded, by the way.
They have a particular head shape.
Oh, come on.
They do. I mean, it seems nicely.
They sort of have a round head.
Yeah.
Arguably.
Yeah.
They sort of have round heads. My head has a lot of, but I like it all the same.
A lot of what is
Oh, often
bumps and projections.
Well, it gives you character.
Thank you very much. Oh, I think today we're really working together nicely. Anyways, so you think that it's possible to mold the head? I'm just
setting the tone that the Ashantis do that. And they have a certain...
I thought it was an Akan thing though.
What was the friend Ashanti tree? That's what they call it. Like that shape.
My mother did not do something for me.
The head looks...
I know, I'm serious. What my mother did for me, she's ensuring that it's being done to generations that have come after me. It's not part.
Anyway, but...
Fema, what do you think?
Oh, it doesn't really give shape per se. But I won't deny that I have done it.
You did it to give shape.
A little bit, no.
Yeah, you probably didn't do it for the shape.
No.
So because it's kind of soothing.
Yes, and the water is not that hot. I mean, seriously.
David, what did you do in the add up?
Oh, it's hot water. That means that then I didn't do it. Because what I used was not that hot.
Good. What did you do?
Hang on, don't want to them now.
Are we roasting heads or like baking bread?
Like I said, today I'm being very passive in this discussion.
Nonetheless, if it's that hot, are there any repercussions now?
I mean, first and foremost, we come with our character, the head, what is going to be. It's sort of pre-programmed.
You sure it's not influenced by the birth canal?
No, so the birth canal, when it's coming in, the head, you see, God is very sharp guy. He has done it such that Tinurban, no more shame day.
Exactly.
There
are a lot of spaces in between the bones.
You see, when the baby's head here, there's a hole there initially.
Yes.
And the bones, if you have a new baby, check the bones, you can feel some steps in between.
Yeah.
So the whole cranium literally munches together and comes out again. Oh, into not the shape not
munch biscuits and as
see, today we're being nice. So I'm not going. See, so us is doing that. The child, if your father's head is 4 bucks, or your mother's head is 4 bucks,
how much
based on those genetics, you would get that 4 bucks.
Are you saying that the Ashanti head is genetically programmed, not necessarily the hot water?
Probably.
Molding?
I'm just making an inference from the fact that their head shapes look nice. You don't get those funny projections today.
But his head is black.
No, if I turn the back, you see what she's talking about. The back has some things there. It's okay. I mean, it's fine. I mean, we've gone past it.
Would it cause any damage to the baby though?
This hot water
and the molding that happens.
Apart from the scalp, I don't expect it to cause
any brain issues.
Okay.
No,
now you're going too far. And that means you're too margin. I told you it was
given how sharp you are, I don't think it's true. But anyways, my point is, if you have Ashantis in the diaspora, they don't tune their head, but their head is still round.
I don't mean them steady.
Yeah,
I have a friend who has nice Ashanti head.
1 man steady.
Oh,
yeah.
How you? Anyways, I don't think that using the hot water to do the head would do the head shape the way you want it. But like Abba says, it's soothing, it relaxes the baby, you know, like a massage. After that, the baby is likely to sleep well for you, you know. So those ones are pluses. If you go and use water that is boiling like that, you cannot even hold with your old fingers.
Well, what a season this has been. Celebrating 10 years of sponsoring life-transforming surgeries and bringing together expert medical advice so that we and you out there can actually make informative choices and live healthy, fulfilling lives. Now, for those who missed all those 10 years and actually have missed the entire season, I can't believe you did that, actually. But we got you. Let's recap some of our best moments.
"10 years of amazing stories from various beneficiaries. We know you are probably trying to remember what happened in season 10. We will give you some highlights on our most exciting moments. 2 new segments were introduced: Jewels in the Kitchen and This Week in Medicine. Come along with us as we relive this exciting journey. Little Miss Amayao was our first beneficiary case from season 1.
That my parents supported me in my condition, and also Vodafone coming in to help me. It's just by God's grace, and I'm happy.
Just like your name.
Yes.
It was lovely having her on season 10. Charles Dramina had a condition which prevented him from enjoying his childhood.
Grandparents actually me say akranu omowo no ye normal, but onyini be 2 years e kono mu hu say nefu no eye kese
na o twimi ni kura na se be one da nti wan san so awone.
He was diagnosed of Hirschsprung disease, which requires surgery.
Mini kapre na mura funku say omo be so mu ama me nanan onwa hwem bi ama no ti nyame nam da na se.
We thank Vodafone Healthline a lot. They've really helped us to relieve our burden.
It was rather unfortunate for Jaden to be born without genitalia.
I wouldn't want to from beside the old for stay a while, buddy. Namsa. Okay, no one to my man answer. Ye, no so. I've been to my casa. Nam so a friend who ye. Na a banamo one who saw a bang and a besia.
And some question no. Any Newton.
Ni banging no. Neshua, no, Shwana so a copper no. No ban and a bona or than Cassanti from all being Okotimino. A one onibi.
This child is passing urine from an opening which is not through the penis, and even though we have formed one artificial one for him, he's going to need surgery in order to bring the urine to the tip of this phallus.
Oh, sister, the moon waji.
But the Vodafone fast there. Mamma the batu and name so. Who did the mob on a situation or about what?
What if Madam one answer?
Mr. Daniel Akono, a mechanic, was confined in bed with a spinal cord problem.
Isimia, mintumin nasi, a damn sissy a chinsua, didn't short time, na, as a shim to sit ja.
Dear Coco Luguna was say, I owe ne concha. I say, don't pay you when I see, I say, spinal cord. Be almost on bay and say you pass for a non penna, bema, obey me, sorry. If you send Tini Biasi, one a mojan intimate flow be. Entina, the BBS season.
A crime in nearly that's why I said, maybe a mania would have from former Mabi Humbo. I call him, said this on my mamma. There's a dark as a pabema with that from foundation for
medical myths which had the internet buzzing.
Please, being a man, please do tell them whether it's true or not.
Yes, it doesn't permanently expand.
Usually because the vagina is an elastic, predominantly elastic tissue, it stretches and comes back to near normal. But especially when after delivery you put in the effort to exercise and tone those muscles and strengthen what they call the pelvic floor.
Theo, how many bars of chocolate must you consume? What's an aphrodisiac?
The aphrodisiacs are stuff that we take into, they say, to enhance sexual pleasure or to enhance arousal. So it's just an enhancer.
Okay.
You know, so technically that's the definition. There are a lot of natural things that have been thought to have aphrodisiac
I know a
effect.
few.
I'm sure I'll leave that for you to elaborate on.
I think that if the woman had eaten the chocolate, it would have been better.
Because
the man there, once he's
true or
called,
false?
once
It is
he's
true
called,
or false?
you know what I mean. Once he's called to the bar, he will jump it.
I can propose, it will not stop the diarrhea, but it will help to rehydrate you and keep your blood hemodynamics stable, your blood pressures.
Now am I ready to just pounce on her?
But the catchphrase here is that a lot of diarrheas are self-limiting.
Thank you.
Our specialists on this season were extraordinary. We met Dr. Agri, who is a trauma surgeon at the 37 Military Hospital in Accra.
I'll first see to the wound on the head.
Why the head first?
Right, because the scalp bleeds a lot. Okay. Right, and then the approach is to first start with the head, the body, before you go to the limbs.
Dr. Richard Day Asamoah, a specialist psychiatrist, throws light on how to handle depression.
But when you are Dr. Mumba Monchen or Kolobu and baby a psychiatrist, when I'm to me wow.
Sapepepe, and in neighborhood, no baby or I eat me, Emma, Obia, suicide. The only time we can't help you is when you have completed it. We and the intimate. Now, so once I do some pension, you will know bit me amount. Your psychotherapy, your doctor say, and I say, I answer for you know, Becassa, a church, your crab fasua, be free, how now woman. We look at your social setting. So we see more, we will have bit me. Dr.
Paddy Ayete, who is an obstetrician and a gynecologist at the Kolebu Teaching Hospital.
The high insulin that is doing this then. You know, say insulin a comogen.
Yes.
A comogen might be all over the body. I do ovary. I catch it ovary. Say ovary make male hormone.
Oh.
Two things get popping up in jewels in the kitchen.
Anti-inflammatory properties, antioxidants, or antioxidants also. To say because the only way anti-inflammatory. Na just say one meal crow inside. What the antioxidants are? Just say my nyinche, a mapomudin, a manhodin.
Let's turn our attention to some medical history around the world. Right here in Ghana in 1999. We had the first Siamese twins separated.
They were joined from the lower portion of their chest and the abdomen, and they shared a common liver and other vital organs.
The world's first total penis and scrotum transplant was performed by surgeons at the Johns Hopkins Hospital.
The patient was a veteran that suffered a blast injury at war in Afghanistan. It took 14 hours to complete.
And a Chinese man had his hand grafted to his leg to preserve it.
The procedure was scheduled to be a two-stage procedure. The first was to attach the hand to the leg to allow for satisfactory healing in the wounded area to deal with infections, and then reattach the hand from the leg back to the upper limb.
Let's pick up this conversation on our social media platforms.
Also bet me nya kwanya sronko a ye nije ye power Vodafone so. Ye the data bundles are any seso Ghana ha bro. Ye ma da so. Ye ni da so nyina bem. Enti beka ye ho nya data mo nije power bebre.
Vodafone, further together.
Well, I did tell you that our very own will be in the hot seat. And who do you think it is? KK or Abba? You know me, I'm biased though. Ladies first. So Abba!
Yay! Finally, the hot seat.
Yes! Hot seat, not myth related, not stories related.
Straight up cardiology.
Exactly. It's actually lovely to have you talk about your field.
Thank you. Thank
you. Today's topic is quite dear to all of us. Heart attack. There are so many things on social media. Some even claim that you can save your own life when you have a heart attack, insinuating that you don't need a hospital and all that. It would be good to delve into those myths and really tell us what it is.
Okay.
Everybody knows the heart. We can feel our heartbeats and all that. But akumana kasano, is it straight like this? Is it here or here? And apart from airborne benefits na wom.
All right. So the heart is, in my opinion, the most important organ in the body. Of course,
you'll be biased.
I mean, it's the one that is supposed to pump blood, that contains all the nutrients and all the oxygen that the rest of the body depends on to function. Okay. So if the heart stops working, really you are gone. There isn't very much else that can be done.
No wonder you're saying the most
so that
important.
makes it the most important organ in the body. And it's a very muscular organ located usually underneath the left breast. Okay. So you say, I'm a high meow, and you think it's from the heart.
Yes.
Usually it would be, but the heart is not in the middle of the chest.
Okay.
It's underneath the left breast.
Underneath?
Yes, like behind.
Okay.
Behind the left breast.
Okay.
Okay. And its main function, as I said, is to pump out blood, but also to relax and to receive blood.
Okay.
Okay. So that it supplies the body what it needs. But being the workhorse, so it needs its own supply. As in like,
so no did
exactly.
Bible says we don't muscle the ox whilst it's grinding the grain.
Exactly. So it will also require some blood supply of its own, containing adequate oxygen for it to be able to do what it should do.
So how does it do that?
So the heart has its own blood supply. Okay, and during its relaxation, it fills into all these vessels. These vessels are called the coronary vessels. And the coronary vessels are the ones solely responsible for supplying oxygen to the heart itself. Yes, so that it's able to do its job. So then the issues become tricky when these coronary vessels somehow are unable to do that function. It means the heart, who is supposed to pump blood for other organs, itself, it's starved. And therefore unable to do it. And you know, oxygen is so critical. So if you don't get oxygen, the muscles begin to die, and dead muscle cannot pump blood. So that is the beginning of a cascade of very, very, very serious events. And that, in a nutshell, is the heart attack.
I was going to ask you. So is that actually heart attack, when the heart begins to die?
Yes. So if for some reason the blood supply to the heart is inadequate and it begins to die, that is when you say a patient has had a heart attack. Now, there are several mechanisms by which the blood supply to the heart can be cut. Typically, it's because there's a clot that forms within the coronary vessels. Now, the
clots, no patches, a blood clot,
exactly, exactly, and that's because coronary vessels, as you're growing older, certain things occur in the lining of these blood vessels. We call them plaque. And these are like little bumps that occur in the walls. They are fat laden and they grow bigger and bigger and bigger with age and with other risk factors like hypertension, diabetes, smoking, poor dietary habits. Makes the plaque grow within these very small coronary vessels. In Tiabedu baby, these plaques can just break up or rupture. And in the body's attempt to secure that rupture, small blood vessels and small blood cells are laid on to cover it. And in doing so, it blocks the vessel. Can you imagine? This is the coronary vessel. And there's a plaque that has ruptured here. And then the body starts laying down these small cells to try and secure the clot. It will eventually occlude the coronary vessel. Occlude means close. It will close the blood vessel. It means the moja kakra na ebefa na supply the heart itself and so I blocked. And so that part of the heart that is supplied by this vessel won't get any oxygen. And without oxygen, tissue dies. And when the tissue dies, the heart cannot function.
So does it heart attack? Akumano is beginning the baby and infant say clot na akwashe ama moja no entumi ndie fusani nkoda part of the heart no. Ewu ansana nimso bechen how ebehu say be anya heart attack na bi ewu ansana wonya saa wo symptoms of heart attack no anase afei na ebewu.
All right, so the symptoms that you actually feel are the heart's cry for help. Because once the blood supply is cut off, the tissue the tissue meaning the heart tissue itself undergoes some changes that sends a signal. One of the typical changes would be the presence of pain. So the presence of pain is the heart's way of saying that I'm in need of something and I'm not getting it. Nothing I need is oxygen. So it's one of the first things that would alert you that there's a poor blood supply to the heart.
That pain na wokan and that's the same.
All right. So the pain is usually described as being retrosternal. This is the sternum, the heart structure here, the bone in the middle of your chest. And this pain is usually described as a sharp or a severe pain at the back of this bone, which typically would radiate or spread out, from the now called left shoulder.
Left
shoulder. Yes. And now say jaw.
Left and also left jaw now.
Yes, and now sometimes to your back. Okay. Now this is the classic way that they would present, but heart attacks don't present classically all the time. Indeed, there are patients who get heart attacks almost feel chest pain.
Okay.
Yes.
How would they know?
So those are the things where there are other atypical ways by which they present, such as they might just be having nausea or sweating, or they'll present with evidence of the heart being damaged. Because when your heart attack now, when into akomano muscle no ewu, and na enye juma ye, into juma na enye into me ye no, and who sunso, and na ube hu. Ti akomane to me pompi ya insuko jina wo chest, insuko jina wo nase, akomane bo kim, wo brain tem, wo me and siso. Now those will be symptoms of heart failure, and heart failure occurs subsequent to a myocardial infarction.
Wow.
Which is a heart attack.
Wow. Me dream who said, ya no. A bet to say, binim sem obi an wo me say kinda. Akopo adomunti. But a bet is obi a bo mu ana say, and our pain is such that say there's no way you can mistaken it. Say, wait ye, e ya makoma and e me ya.
Okay, so that's an important question because there are several causes of chest pain. And a heart attack isn't one of the commonest causes of chest pain. Okay, so you'd have to use several things. We would use that in medicine. We'd use the history, the exam, and the physical findings that you get during the exam to try and determine whether chest pain will feel, is it very likely to be from a heart attack or not. For example, you have a young 18-year-old girl complaining of neha, on your hypertensive, on your diabetic, on your dyslipidemic, on no cigarette. And so also high just because of the age and the lack of risk factors, it makes it less likely. And if you compare it to a 65-year-old man, hypertensive, diabetic, presenting with chest pain. So we put all of these things together to heighten the diagnosis. But typically, the pain is a severe retrosternal or the back of the bone. Yes.
It's like my in. Because my in is hurting. Inside your in. Chai.
Chest pain. Which is constant.
Okay.
And
lasted for a while.
Lasted for a while. And say jaya, usually a jaya because somehow blood vessel no a supply number. And now say akoswa mama so no efe ewu. Into me empty amubio. Because I told you earlier on, say the pain you're feeling is its cry for help. When it dies, it doesn't do that anymore. So sometimes then the muscle actually dies. Then the pain goes away and we might assume say, oh, not necessary.
Matisse, and the way I meet be. Matisse, it's me nam ebusuamu. In some of them sister be. Odi in the 40s or odi 40 pen or start offer aspirin. Or say half aspirin and every day or say one aspirin kind dosage and offer. But not offer aspirin. They be say ni papanya edi 50 or so no nya akumayare heart attack hibi. Ni brothers ni ono your last born. Into ono dear of on passing the what is aspirin bet me prevent sadie. No crebi wo mu ana. And that was the role of aspirin in a heart attack.
Okay, so good. So I'll focus on the scenario that you painted. As I said, there are certain risk factors that predispose a patient to getting a heart attack. Now, some patients are at a very high risk of getting a heart attack, and you can determine this in the hospital by putting all their individual risks together and then calculating a score to say that, oh, you are at a very high risk of getting a heart attack, or you are at a moderate risk or a low risk. Now, aspirin is the fulcrum of managing a myocardial infarction. When it has occurred, it is one of the central drugs that we would use in treating the patient. In certain peculiar instances, like the patient you described, who has a very significant family history of heart attack, who herself may have other risk factors, then depending on her assessment, you might want to consider putting her on aspirin as what we call primary prophylaxis, meaning that when you heart attack, also you say aspirin and they prevent it. But having said that, I want to throw a caution out there that we don't routinely encourage the use of aspirin just to prevent a heart attack, because aspirin has a lot of effects that you don't want. And want to weigh the risk and the benefits of using this drug. So we would assess as medical practitioners and determine whether you are at a very high risk and therefore your benefit from the aspirin is higher than the risk.
Okay.
But having said that, it is a pillar in managing a person who has a heart attack.
Answer my compensation this last question. So be who say sa pain ya sa pain ya or describe be no. Then na onye so that akomano you know what can the person do? Is there any self-help thing or the only thing is just to find a doctor?
Right. So self-help in an acute myocardial infarction is very limited. You need definitive treatment. Picture a very tiny vessel. Usually the diameter is about 5 millimeters. Na a blockade. Na air supply an organ as major as the heart. We don't have time to use self-help measures. Indeed, in other parts of the world, so many algorithms and steps have been put in place to save muscle. They say time is muscle. And so we don't have time to waffle around with self remedies. If you have aspirin at home and you think you are getting a heart attack, you can take aspirin usually comes in Ghana as 75 milligrams. You can take 4 tablets. That would be 300 milligrams, which is what we would give you in the hospital. But it is critical that you get into hospital early because we need to determine what mode of treatment would be relevant in dealing with your kind of heart attack. I won't go into too many of the details, but there are different types of heart attacks. One where the vessel is totally blocked, almost 100% closed, and some where it is not completely closed, so some blood still goes through. The management strategies are different. So when you come in early, we'll decide what must be done for you. Is it that you need to go in and get the vessel opened through more advanced procedures, or we use medical therapy? And then it's important that you come in early too, because we can determine your complications and manage them quickly. Remember, time is muscle. For me, that is the take home. You need to get into a facility real quick.
And the back one say, "O can you imagine? So it's not fako. Now Nigeria. What's na ya na ice and nine? Imagine your heart.
Yes.
You know, so it's like you've compressed the vessel. And that's what's now moja vein be so. And I'm a moja in difference and in call them. Those on 9 BBS and Nancy Achi 9. Into mefa heart attack to say, and Nancy Achi wakuma. And the patch Nancy Achi wakuma. Anna wakuma no kem say, Boamio na me bre. Ni person boa. Ni
Boame no menko ni
na baby for hospital. For hospital.
Exactly.
Aba. Magrelo kakra de.
Why are you?
Magrelo kakra. Oh my yati ase. Heart attack de. It's me for lives actually. It's me for lives. So important say we know what to do. Me pacho where they are back on a kit where be. When we say pain na starts at the end, men go to the nearest hospital. And I'm sure that they'll be able to do what you need them to do for you and save your heart. Because it has to last you a lifetime. Oh. You don't want that cardiac surgery. I'm sure that it costs a huge amount of money.
A huge amount of money. Huge.
Well, we'll be right back.
Now you can be part of the extraordinary world of endless possibilities on Vodafone. With the best value and amazing data offers and services available in Ghana, your dreams are achievable. Get more for less with Vodafone data. Vodafone, further together.
Today in This Week in Medicine, we will throw some light on, can you guess? Endovascular surgery. The first approximation of the arterial wound was in 1759 by Hallowell. Nearly a century later, John Murphy performed the first arterial anastomosis in 1897. In the 1700s, the Scottish brothers William and John Hunter directed clinicians to the understanding of aneurysmal disease, treating primarily by ligation, that is, tying the aneurysm off. For the progress of endovascular technology, credit goes to a long list of medical innovators. First and foremost is the Ukrainian Nikolai Volodos, who performed the first endovascular thoracic aneurysm repair with a stent graft. However, the endovascular evolution was sparked by the publication of Joan Parodi and Joe Palmas, who reported the first successful transfemoral abdominal aortic aneurysm on 7th September 1990. Ghana has not been left out with endovascular surgeries. This was realized when an illustrious son in the person of Dr. Ben Sarkodie, the first interventional radiologist in Ghana, started doing endovascular interventions in 2015. In 2019, he led a team of doctors to perform a groundbreaking endovascular intervention in the brain. In simple terms, we can say they performed a brain surgery without opening the skull. Since then, over 50 of such cases have been done. The good news is, several interventional radiologists are currently being trained in the country. And that's some year can operation away what the fa ye mojantin our arteries. Oh, no here pa arteries no ma mojofo afusan wonyimpa not to the beer. I there water hosen na baby why yemro or yemrowa honum otum opoi or the balloon on na brunyu friend aneurysmal disease. Na in termina and soa more bany there, honor way pay why weak no way paying otum pay. On na brofu why you a corner obutum why obutum wash a honum nedzen. Bohono was a two kitty was a fat in tin vessels no the mam or could be on my dam, neither waste or honum no quan. I bring your friend stents. Now, a wayan in as all often interventional radiology, which other on one boy in pon. Oh, yeah, what your honum kitty be? No, why enter blood vessel no. I baby a moja for a sign on Nipanum. What do you know, wash it, even wash extra the man will cook. Baby a honum problem no. Not what's it, as it was from honum. I the mark of organize and wa patch type. Baby dam. Endovascular surgery is all about. Now, Ghana news to her or your demo operation or church a Ghana for so style avoid demo operation more by ya. Ghana for one here, operation dam wubutum wenya. This is all we have for this week in medicine.
Vodafone, further together.
The final jewel in their kitchen doesn't mean that's the only jewel in your kitchen. Trust me, there's many more. But I just want to talk about greens because I've mentioned okra before and how lovely it is to make that okra soup or stew with greens in there. Greens, you know. But what is in there is not just folic acid, calcium, vitamin A, and the rest. But yes, it is anti-inflammatory. It is packed with antioxidants as well. But it has a great way of helping us reduce our risk of obesity, reduce our risk of anemia, reduce our risk of hypertension, and many other diseases that is metabolic related. The bone benefits from it. Remember I mentioned calcium earlier. The bone benefits from it, your heart benefits from it, your skin benefits from it. Honestly speaking, greens are indeed a jewel. So don't forget to add some into your food. I just want to caution us about a few things when it comes to our greens. If you are taking blood thinners, you know, when I say blood thinners, I have never come medical because there are certain things going on in the body. Dr. Catcher will say, oh, men the green. Let me cast pharmacy me the green to me into doctor. Doctor and the upper chain say there's something in the greens called vitamin K that will counter a drone or the mound. Intimistral, I am doctor and advice. No, 255. Yeah, but please, if you're on blood thinners, don't touch the greens. All right, till doctor has taken you off that medication. After so greens, no, then tea be normal. Ye no ane kakra se kontomre no. Ye no manembro so kakra bi. It's because it contains something called phytates, nitrates, and oxalates. Yes, nutrition words. What does that mean? Those are anti-nutritive substances that hinder the absorption of certain minerals like calcium and iron, sometimes even zinc, and you do not want that. In Kakra, reduce the amount of that in there. Last but not the least, one other thing that you can find in some greens like broccoli, but this one is not a green, cabbage, but it falls in the same category as this one. It contains something that prevents your body from absorbing iodine. Into your beer, who go through iodine deficiency into a goiter, and as Dr. Catcher said, iodine levels in yeah. Mr. Stay away from cabbages, broccoli, and it likes, okay? All right? Are we okay? Good. Thank you very much. And that is my last jewel for this season. But there is more.
Now you can be part of the extraordinary world of endless possibilities on Vodafone. With the best value and amazing data offers and services available in Ghana, your dreams are achievable. Get more for less with Vodafone data. Vodafone, further together.
As for me, I'll be biased. Nutrition stood out for me this season. Really, we couldn't have trumpeted it more. It was in fatty liver, it was jewels in the kitchen with me, Freeman, not because it was with me, Freeman, but the fact that we got the opportunity to show our cherished viewers, and as we have to learn together, that these little things in our kitchen make a huge difference in our health. Not because it just has vitamins and minerals that we are used to hearing, but it's got these phytochemicals that are anti-inflammatory, antioxidants. And if you miss that, it just means two main things. Anti-inflammatory means if there's any wound inside you do not know about, inside the body, these things help heal that. Antioxidant means that basically gives you good health and helps you age beautifully. So for me, that is my highlight. I told you I'll be biased. There are many things, there are many highlights, but I'll be nutrition biased today. Sorry. No, I'm not apologizing for that. No. Okay, what is your highlight for the season?
You know, from as far as I can remember, Vodafone Healthline has always been something that has inspired me. You know, 10 years ago I wasn't here. You know,
yeah.
So this has inspired me. You know, to want to do something, and going through this week in medicine. You know, going through the content that we had to share, you realize that we've had Ghanaians do great things.
Yeah.
We have Ghanaians doing greater things. In fact, I'm hoping that in the coming years we'll be able to find out more Ghanaians. Find out more Ghanaians who are doing things and celebrate them. You know, because in celebrating our own, we're likely to get more wanting to work hard enough to be celebrated. And hopefully we can together push the frontiers of medicine even higher.
Yeah.
Indeed, the families that have been touched, I mean, it's been great.
Yeah. Yeah.
Yes, I think that what stands out for me is the the beauty of the human spirit, willing to impact in the lives of other people. I think that when somebody finds themselves in a situation that is difficult, such as ill health, the negative impact of that goes a long way from beyond the person himself to his family, to the community. But in the same way, the help that other people give, such as Vodafone, impacts not just on the person, but on the family and on the society as a whole. And I think that that's a beautiful thing that we learn from not just this season, but for the past 10 years that Vodafone has given to us. It's a good thing.
Yeah, it
worth
is a
commending.
great thing. Yes.
Yeah.
Yes. Once again, I like saluting. Vodafone Healthline, we salute you.
Yeah.
We'll be right back.
So that mom can be able to open the door. This is it.
Here's my little brother doing something special. He's setting the camera up with another bright idea.
Let's just open the door.
Yay!
Mom, I got it.
Now you can be part of the extraordinary world of endless possibilities on Vodafone. With the best value and amazing data offers and services available in Ghana, your dreams are achievable. Get more for less with Vodafone Data. Vodafone, further together.
What a great way to end this season. The 10th edition of the Vodafone Healthline with our own Abba in the hot seat. I hope you learned something.
And what a hot seat has been the whole season, full of useful, relevant information from experts in their areas. Prima, it's been great, hasn't it?
It has been great. And honestly speaking, I enjoyed grilling you. I did. I mean, I had a lot of experts come in, but Abba was special because I get to grill her outside Mythbusters and stories. And it's nice for her to tell us more about her field. So I enjoyed that. Another thing I really enjoyed. Hey, if you're Buffy, Masa, is that called? That's flat stomach.
Well, I was always doing the exercise, so you did not see me.
Masa, Jai.
Oh, I was standing.
You're one pack. You see? You see? Oh. Well, don't worry. Just see Ifia. She'll give you that. But till then, Ifia had a seriously flat tummy and the stretches were epic. Honestly, I think that we underestimate the power of stretches, and she's taught us a lot about it. Doing it before exercise and after prevents injury. But one trick I learned along the line was that stretching properly actually tones certain areas. You want to try that. Yeah, I enjoyed it here. I did. What about you? Any special enjoyment apart from aphrodisiac?
Oh, Fema, we agreed that we were on, you see, aphrodisiac is for all of us. It needs me, it needs you. It needs all of us. The chocolate, you remember the chocolate man? It needs me, it needs you. And I was advocating for you to get some chocolate. That I'm sure Mr. Fema gave you that chocolate that day. But you did not come and say thank you to me. So you're welcome.
Now, who is Mr. Fema?
My husband.
But why Mr. Freeman?
I want
now, Mrs. Yalia. No, Mr. Freeman.
Well, Abba, any final words for us?
I think that a lot has been achieved this season and indeed over the past 10 years. And it's been dynamic. It's been informative. It's been relevant. It's been useful. And there's more to come. Keep watching Vodafone Healthline.
Yes, indeed. It's been fun. And don't forget that if you have any questions, you can't remember something we said, and you want clarity, there are doctors, there are medical practitioners just waiting for you to call. Pick up that phone and call 255. For phone, for 255, a doctor for omo try answer our questions. Hey, free oh. Hey dear, one free, one ayo. Hey, free. Just call them. They'll answer all your questions. and you know what to do because now you are empowered. What more do we want? Till we meet again, stay healthy, stay truthful, stay loyal, and let's build a better Ghana. Hi.
Bye.
Vodafone, further together.